Do you find it hard to sleep at night because of muscle cramps, numbness, and pins and needle sensation in your lower leg and in your foot? You're not alone. That's why in this video, we will talk about the do's and the don'ts for you to sleep better tonight. Stay with me until the end of this video because the last tip, it is a common misconception that many are not aware that it can actually trigger sciatica symptoms. Hi, this is again Doc Sherry, Doctor of Physical Therapy, teaching you practical health tips and home exercise programs that you can surely benefit from. For many, sciatic nerve pain seems like a cycle. They can't sleep well at night because whether we like it or not, neuropathy symptoms are really worse at night or early in the morning, affecting one's ability to sleep better. If you were not able to sleep well the night before, you can also expect more intense type of pain the following day, affecting your work and your ability to do usual day-to-day activities. The information that you will learn today, try to apply it. These are simple, practical strategies, but these are foundation information that can really be a game changer in managing sciatica symptoms naturally. Do ensure physical activity all throughout the day. Try to check and try to evaluate what are your activities on a day-to-day basis. This is to remind you that with sciatica, you also need to stay active. Do you know that sedentary lifestyle such as prolonged sitting, it can actually increase the pressure in your intervertebral disc. Now, this is relatively very important, especially if the cause of sciatica is due to disc herniation. Sedentary lifestyle can also cause tight muscles, which can eventually increase your pain. When you exercise, when you stay busy, these will ensure that you have proper blood circulation, which is also very much needed for nerve healing. Now, this does not mean that you tire yourself, especially for those who are diagnosed with osteoarthritis of the spine or lumbar spondylosis. The key here is to strike a balance between rest and movement. You need to move whenever you can and rest whenever you are tired. For our seniors at home, gentle stretching and even walking inside your garden or in your neighborhood. This is a good exercise for you to help ensure that you sleep better all throughout the night. Do sleep in the supine position. Do you know that when your legs are elevated and when you assume the supine position, this is actually a good position which will reduce the pressure in your intervertebral disc and will help lessen symptoms of sciatica. So to do this, you lie supine, you get a pillow and then put it beneath your knee and try to check and evaluate if you feel better when you assume this sleeping position. Do side lying position. For others who are not used in sleeping in the supine position, your other option is to sleep on your side. It doesn't matter if you face the right or the left. It depends on which one is more comfortable for you. Now this time, you're still going to need the pillow and put it in between your knees. In this position, we also lessen the pressure in your sciatic nerve for you to sleep better. You just need to be mindful as well to change sides every now and then. On some days, you may be facing the right and on some days, you face the left. This is also important for us to prevent shoulder pain, especially if there is excess body weight. Now, here are the things you shouldn't do. Don't do the wrong body movements. These are very important because one wrong body movement, it can actually increase low back pain and can trigger sciatica symptoms. This is something that you might have overlooked as well. When you rise from bed, don't stand immediately. What you want to do is to turn to your side first, then lower your lower leg and your foot down, and using your hand and your elbow, you try to push your body upwards, up until you are in the seated position. Then give yourself a couple of seconds or minute, and then you stand. Many are not aware of this, but rising directly from bed with the wrong body movement, it can actually increase your symptoms. Avoid lifting heavy objects, but if it's really important, bring the object or the weight closer to your chest. This way, we evenly distribute the load in your spine and we prevent sciatica symptoms. If you need to pick up something from the floor, you need to practice this. Bend your knees and not your waist. This way, we ensure we lessen sciatica symptoms. Avoid sleeping in your stomach. Although this is a comfortable position for many, this is not good for your spine. In this position, it actually arches the spine, which can further increase the pressure in the sciatic nerve. If you're going to look at this position, it's also not good for your neck because the neck is tilted in one side. And eventually, what you can expect if you won't correct this is the fact that now you may be suffering from low back pain, but eventually it can also affect your cervical spine or the spine in your neck area. Don't sleep on soft mattress. This is a common misconception because others are thinking the softer, the better. But that's actually wrong. With sciatica, what you need is a medium firm mattress. Something not soft, but something not that hard as well. Try to check your mattress. If you think your mattress is already sagging and it cannot support your spine while you sleep, what you can do is to put a plywood underneath your mattress. This will increase the stability to support your spine. For those of you who want other option, your best option would be medium firm orthopedic mattress. You can easily buy one in shops near your place. Check the warranty and check the quality and the reviews as well. Although these may come in expensive, but it is a good investment for your health and for the health of your spine. At the same time, it can really help you sleep better. For those of you who are asking if you can still work if you have been diagnosed with sciatica, the answer is yes, because in majority of cases, patients who have been diagnosed with sciatica can live active lives. So long as you don't feel the following symptoms. You don't have any difficulty standing and you don't have any difficulty with walking. You don't have or you don't experience loss of balance. You don't have difficulty or loss of control in urination and defecation. And you don't experience progressive muscle weakness in your lower leg and in your foot. The information that you have learned today, these are foundational information to help you sleep better at night. Simple, practical, but it needs practice so that you will stay pain-free and for you to sleep better. If you have reached the end of this video, please comment working or retired in the comment section below. This way, I can tailor fit future videos according to your needs so I can help you better. Thank you very much for watching. This is again Doc Cherry. Stay safe, stay happy and healthy. God bless you.